Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the Gluteus Medius assessment. What is a Gluteus Medius test or assessment? The Gluteus Medius is a muscle that can be found on both sides of the hip. It ensures that your pelvis is level whenever you walk, plus it also allows you to move your thigh to the side, which is typically called hip abduction. Injuries to the Gluteus Medius are rare, and because of that, it is typically overlooked. However, signs of a Gluteus Medius injury include the following. The patient has difficulty walking because of limping. The patient has difficulty sitting down. There is pain on the side of the hip or the buttocks area. There is swelling or inflammation on the sides of the hip and the affected area is soft. The hip has a reduced range of motion, and it hurts or causes discomfort when moved to the side. To determine the presence of a Gluteus Medius injury, you can conduct this test, which involves moving the hip and assessing it for weakness. The test has three components: the straight leg raise test, hip abduction test, and leg weakness assessment. As a result, it's commonly used by physical therapists. How to use a Gluteus Medius test. The first step is to fill in the patient information at the top and gather materials. You'll then need to read over the instructions and conduct the test, adding comments if needed. To view a sample assessment of the Gluteus Medius test, feel free to visit carepatron.com where you can download and access the test for free. You can also access the test through our platform. Simply filter by community assessment and type in the keywords to find the note. You can also edit however you wish. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare videos.